So my name's Letty. I work for a service called CAS, which stands for Community Access Support Service. And I work to raise awareness of mental health services in the community with community, equality and faith groups. So I'm a CAS networker in the north of Bristol, so I've also got colleagues in south and central and east Bristol. I'm based at the Greenway Centre in South Mead, but I cover kind of priority areas of South Mead, Lockleys, Lawrence Weston and Avonmouth. So we reach out to groups in the community and the voluntary sector to give information about mental health services and also work with them in any way that they might need in terms of kind of opening up conversations about well-being or mental health with their community, kind of feeling more able to do that or deal with situations as and when they might arise. So yeah, for any reason why a group of people might find it more difficult to access services, there might be certain barriers in place, and it's for us to kind of actively go out there and reach those groups. And for some people, we speak to them and say, we've been needing this for years, mental health is so important, it always comes up. And for some groups it kind of is more they kind of go, is mental health an issue? I'm not sure. And but actually people, it is an issue for people, and like men's groups, for example, kind of there's some real barriers there in men talking about mental health. Often men don't reach out for support, yet suicide is the biggest killer of men under the age of 45. So we know that it's an issue, and it's us kind of getting out there and being able to explain it in a way that makes sense to people, and working with kind of key members of those communities so they can go back and kind of and spread that information and kind of pass it on in a way that makes sense to them. Diverse in the work that we do and who we work with. Quite creative, because you have to think differently and adapt your approach according to kind of what the needs of the different communities are. And fascinating, really, working with so many different people across the city and learning so much and being part of that. It's a really interesting job. I think it's the kind of the creative element to it actually, and being quite reactive to what the needs are. Recently I was part of a sports campaign to promote the benefits of sport for guys, local guys in South Mead clubs, promote the benefits physically but also mentally. And we were telling a story a day of local men who are part of these sports groups, and it was kind of a Facebook campaign, but also a link to a full sort of interview article. So that was an interesting, fascinating thing to be doing. I was going down to the local boxing club and interviewing guys there. Nice. Yeah. And then sort of putting together and promoting a campaign, which is something I've never done before, but learnt a lot in the process, and it was really worked really well. Well, they can have a look at our website and find out a little bit more about CAS, and that's casbristol.org, and they can just ring us up and have a chat and talk through kind of the different things that we might be able to offer them. It could be that we just give a bit of information over the phone or email, or it could be we're able to meet up and have a one-off session to give information about services, or it could be there's sort of more kind of prolonged work with a community group, but it just really depends on their needs. It's kind of whatever works for them. So one of our key kind of roles within CAS is to gather feedback from community groups around access issues and barriers to people to using services. So we kind of pick up key themes and then feed that back to commissioners so that they can kind of look at the services that are being provided and see what changes could potentially be made.